Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over 3 major mistakes and things you want to avoid when it comes to your knee replacement, rehab, and recovery. So the first one I want to talk about is pain management. And particularly the mistake is not managing your pain effectively. So when it comes to pain after knee replacement surgery, especially early on in the recovery, pain is to be expected. It's kind of the nature of the beast, unfortunately. Now, we don't have to have a mindset of no pain, no gain. That's not necessarily effective and successful, but you are going to have some pain for the vast majority of people with your rehab and recovery. So we want to make sure that we're taking a multimodal approach to pain management. So what that means is multiple different modes of pain management strategies. So this is prescription pain medicine from your doctor and from your surgeon's office. It's any other medicines such as anti-inflammatories, NSAIDs, Tylenol potentially, and any other pain management type medicine that your doctor recommends and prescribes for you. It also means non-pharmacological means such as ice, using heat. Once you're a little ways along in your rehab and recovery, you can use heat. And I do have some videos that talk about that. Elevation, as well as using different forms of compression, if that's using a compression wrap around your leg and knee, or sometimes people will have compression garments that they're prescribed and recommended by their doctor. There's also ways with hands-on and therapeutically we can manage pain. So massaging techniques, using some light stretches and light range of motion exercises can be pain relieving. And then, of course, there's also alternative strategies, mindfulness strategies, meditation, other ways to practice mindfulness that can help with pain management. And it's important to really stay on top of your pain, especially early on after surgery. For example, if you know you're going to do your exercises soon or you're going to have a physical therapy session, make sure you're taking, either taking your pain medicine that's prescribed or you're using other forms of pain management, because the more you stay on top of your pain, the more you're going to be able to tolerate and really take full advantage of those early days in your rehab and recovery and have a much more efficient return of strength, mobility, function, and just general activity tolerance. So managing your pain, using multiple modes of pain, and staying on top of your pain is very important for your rehab and recovery process. Before I jump to number 2, be sure to hit that subscribe button and turn on the notifications so you can catch all videos related to knee replacement surgery. Number 2 is rushing. So I like to use the phrase when it comes to your rehab and recovery, go fast but don't rush. Now this isn't talking about individual exercises. So individual exercises, listen to your physical therapist. There's certain ones that we want to go very slow and controlled, and that's actually most of them. And there are some that you want to go a little bit faster. But this is talking about the rehab and recovery in general. Go fast, but don't rush. We want to find that happy medium when it comes to your exercises and your therapy and your rehab. So we don't want to go so high intensity with everything that it's going to cause you pain, it's going to exacerbate your symptoms, and make it harder to tolerate activities either later in the day or the next day or two. But also, we don't want to go at such a low intensity and volume that you're not getting the benefits. You're not seeing the improvements in your range of motion or your strength or whatever that may be because you might not be going at high enough intensity. So we want to find that range, that happy medium. And that takes a lot of guess and check early on, especially. It takes a lot of communication with your physical therapist, with your healthcare providers, to find that happy medium where we're getting the benefits from therapy, but we're also not exacerbating your symptoms at least too much, and we're not trying to get no benefit whatsoever and just wasting your time. So this applies to range of motion exercises, it applies to building strength, but it also applies to more functional things, walking, balance, returning to activities, returning to work, returning to activities. Take your time and develop the physical capacity, the functional capacity that you need to do these things effectively. Now you want to make sure and understand, so that part about go fast but don't rush, is those first few weeks to first month or two are very vital and important for regaining range of motion, for building strength and mobility early on. Those are going to be your key window of opportunity to get the most absolute bang for your buck with that. Now you can still make improvements in range of motion and of course in building strength after that time, but this is the time before your knee starts to heal and go through the phases of healing and new tissues are being laid down, new soft tissue and scar tissue is a phrase. Now is the time before those processes occur within your knee to regain your range of motion, regain your flexibility, and also your strength and mobility and all those things. So again, you're not necessarily doomed if you don't get all the range of motion and everything you need, but it is vitally important to really get as much as you can from that early phase of recovery. And so you want to think about consistency and frequency. So doing your exercises and whatever your physical therapist and your doctor recommends and prescribes, doing them every day, potentially a few times a day, especially early on, and just finding that happy medium with intensity, getting the benefits from it, but not going so super intense. It's not necessarily no pain, no gain, like I said in the first bullet. So finding that right intensity and then just maintaining your consistency, your motivation to keep going and get as much as you possibly can. And I always say this, and I'll say it again in this video, it's a marathon, not a sprint. The recovery process takes time. It takes many weeks, many months, maybe even a little more. So continue to stay consistent. You're going to see the most benefits. So go fast, but don't rush. And number 3 for mistakes is having unrealistic expectations, or on the counter to that is not maintaining optimism and positivity. Now, of course, this is easier said than done. I can't just wave a magic wand and say be positive or be optimistic, but you really should be, because the vast majority of folks do have good outcomes from knee replacement surgery. Unfortunately, not everyone does, but a lot of people do. Now, one way to maintain a higher chance of having a good outcome is managing expectations. So one, it's in the length of your rehab and recovery. Again, I'll say it, marathon, not a sprint. It's going to take time, many weeks, months, up to a year, maybe even more, to really feel fully recovered and back to your usual self. But you also want to understand that you need to take that active approach to your rehab and recovery, doing your exercises, following the instructions from your surgeon and your physical therapist to manage your knee and the symptoms and pain and everything as you go through the process. Now again, I'll say this, it's not a no pain, no gain situation, but pain is to be expected, especially early on after surgery. So managing those expectations that you are going to have some pain, some swelling, some issues and frustrations early on after surgery are very common and very normal. But understand that for the vast majority of folks, they end up seeing tremendous benefits from getting surgery, and the vast majority of folks will say, if I had the option to do it again, I would take the decision and go ahead and have a knee replacement. So that's a very good sign. Understand that the pain and symptoms, this intensity and frequency will not last forever. They will continue and improve over time, over days, over weeks, over months. For some people, though, again, those realistic expectations, you may have some lingering symptoms. You may have some lingering pain, swelling, but it's going to be much less frequent, much less intense as you progress through your rehab and recovery. And the pain is temporary again. Remember, it gets better. For the vast majority of people, for the vast percentage of people, they have positive, good outcomes, their symptoms improve, their mobility improves, their quality of life, activity tolerance, their function, all those things improve through the rehab and recovery process after having a knee replacement. So again, have those expectations. We're not necessarily turning back the wheels of time. You're not going to feel like a 20-year-old or a 30-year-old and go running down, an athletic field or something like that necessarily. But you are going to feel a lot better for most people. And just maintain that positivity, that optimism, that this is temporary, it's going to get better over time. So I hope you found this video helpful. Please be sure to hit that subscribe button again. Please be sure to hit that like button as well to spread this video. And as always, please leave your comments and questions below so I can get back to you. Thank you for watching.